morning, everyone. Welcome to our webinar series 2020. This is our talk 8, and we are honored to have a wonderful person with us today. Dr. Smitha is joining us, and she'll be here to give a talk to us. Dr. Smitha, welcome.
Hi, good morning.
Good to have you today, and after a lot of coaxing. But she's got a very interesting talk today, and I'll hand it over to her. Dr. Smitha, a little bit about yourself, your background, everything, and then we'll get started with the talk, okay?
Background.
Yeah, just a little bit about yourself.
Good morning, my friends and colleagues. Background. You all know it better. I'm sure at least some of you had a naughty thought or two regarding the topic, why a bite mark's important. Well, I would have liked to infer from your facial expressions and smiles, but just for my amusement. But as the need of the hour is social distancing, we'll have to be content with this type of new breakfast type meals, I guess. And our CMA coordinator, Dr. Biswajit, has been doing a wonderful job on this. As the name of the topic suggests, my aim is to give a brief overview over the bite mark analysis, its usefulness and limitations, but not what you think exactly it is about forensic odontology. I'll go into the slides.
Yes.
The criminal may lie through his teeth, though the teeth themselves cannot lie. Even though this is not my area of expertise, due to my keen interest on the subject, I've done quite some research in this matter and hence thought of compiling it in a nutshell for you. I'll try to make it a little. I've selected this area presuming that this will spark your interest rather than the regular dental talks. So here we go. And bite mark analysis is based on the principle that no two mouths are alike. A bite mark is a mark created by teeth either alone or in combination with other oral structures. In other words, a bite mark may be defined as a mark having occurred as a result of either a physical alteration in a medium caused by the contact of teeth or a representative pattern left in an object or tissue by the dental structures. Just a brief overview. Now, why are bite marks important? They're often considered as valuable adjunct. I repeat, adjunct to fingerprinting and DNA identification in usual forensic examinations. The following review describes the classification, characteristics, mechanism of production, and appearance of bite mark injuries. Now, how the collection of evidence is done, comparison techniques, and technical aids in the analysis of bite marks. It is a complex thing, but I will try to put it as simple as possible. Examination, this is to attempt to scientifically link the dentition of a potential biter with a bite mark. And it may be found on skin or some other material, and the crime scenes are thoroughly searched for this, just in case we find a clue to the potential biter and thereby the killer. Maybe. And it is used with increasing frequency over the years, possibly due to raised awareness and recognition of such injuries. And it is always from a multidisciplinary approach. Although, and along with the increase in the number of domestic violence reported now and abuse cases, many of which are involving the injuries. Why are these important? Again, the analysis plays an important role. So just by getting a bite mark, it is not a proof enough. It has to be followed by the scientific protocols. And we'll see in our slides how it is done. It can be recorded in violent crimes such as sexual offenses, homicides, child abuse cases, and during sports events, as you all know. The arrangement, size, and alignment are are individualistic to each person. We go based by that theory. Now we go on to the classification of bite marks. Cameron and Sims classification based on the type of agent causing the bite and the medium on which it is exhibited. Agents can be human and animal. We will differentiate between the human bites and the animal bites And the correct protocols for collection, management, preservation, analysis, and interpretation of this evidence should be employed if useful information is to be obtained for the courts. And it is now possible with advances in the technology to produce more and more accurate bite mark replicas. The agents are human and animal, as I said, and the medium can be skin, body tissue, foodstuff, and other materials. In agents, a third thing is also included, that is a paranormal, but that is a little difficult to explain. So I guess, I didn't include it in my slide. Now, the differentiation between human and carnivore bite. We always have to differentiate between the bite of the human and the carnivores here, or the animal bites. Main features are the arch size and shape, teeth, injury pattern, and the site of injury. When you say arch size and shape, the human dentition has a broad U-shaped and circular bite, elliptical, whereas the carnivore will have a narrow anterior aspect, a V-shaped, elongated. So the human bite will be always a U-shaped. Carnivore bite will be narrow at the anterior aspect, causing a V shape for the arch. The teeth in humans, we have broad central incisors, narrow lateral incisors, and a blunt bite compared to the carnivore bite. That is, they have narrow central incisors, broad lateral incisors, and long and sharp canines. Canines are the most distinguishable characteristics in a carnivore. An injury pattern, which shows bruising and laceration in a human bite, whereas in a carnivore bite, it will be severe laceration, avulsion, and greater skin damage. And the site of a human bite are usually breast, abdomen, back and shoulders, whereas a carnivore's bite will be the extremities and the exposed skin. When we use the bite mark analysis as a part of the medico-legal autopsy, first we have to differentiate whether the pattern injury was caused by human teeth. If it is a yes, we continue. If it is a no, we stop there. So when we continue, the classification of the bite mark detail has to be taken, and analysis of the pattern injury has to be recorded, and the report of the findings. This is how we go about in a medico-legal autopsy. And the bite mark comparison or identification or exclusion as a part of criminal or civil justice system. That is, we'll check whether the sufficient detail for comparison or identification or exclusion is there. And if yes, we go into the comparison or identification. And when we compare or identify the suspect, whether they can be excluded or cannot exclude, depends on that. So we have to follow the scientific protocols and the protocols given by the civil justice system and the scientific methods of obtaining the bite mark analysis. Everything has to be recorded in detail, and then the court decides, right? Bite mark analysis have evolved over the years to give more reliable and reproducible results. However, the behavior of the skin and the underlying tissue during the dynamic biting process is still not clearly understood, and caution with the interpretation or the conclusions drawn from these injuries is essential if these evidence is to be useful and acceptable in the court. A forensic dentist can tell a lot about the teeth of the biter based on the bite mark. Depending on the bite, if there is a gap, there's a gap in the bite, the biter is probably missing a tooth. And once the investigators have identified the suspect, they have to obtain a warrant to take a mold of his teeth as well as the photos of the mouth in various stages of opening and biting. And then they compare the transparencies of the mold with those of the bite mark cast, and the photos of both the bite mark and the suspect teeth are compared to look for similarities. That is how they go about it. The complexities of these biting injuries and their analysis and interpretation makes it a great challenge even for the most experienced, because the human bite marks are usually found on the skin of the living or deceased adult or child, okay, victim or suspect. Skin is a living organism, so we'll come to the complexities of it in the next slide. How do we describe the type of bite marks? There are 7 types. Abrasion, that is just a scrape on the skin. Artifact, when a piece of the body, such as an earlobe, is removed through biting. Avulsion is a bite resulting in the removal of skin. Contusion is a bruise. Hemorrhage is a profusely bleeding bite. Incision is a clean, neat wound. Laceration is a puncture wound. And it is essential to ensure that the evidence relating to the injury is documented, collected, preserved, analyzed, and interpreted following the appropriate protocols and using scientifically accepted techniques, as I told you before. And teamwork is always essential for the correct management of evidence from these injuries, and it always involves the police, the crime scene investigators, pathologists, forensic odontologists, and DNA personnel. Conclusions from these type of bite injuries are carefully considered, and it should be free from personal bias and may support or refute a conviction. So getting it wrong may lead to the miscarriage of justice and incarceration of an innocent person or release of the guilty, both of which are not acceptable at all. So we're talking about the clear impression. A clear impression. Impression is something what we do to mimic the dentition of a, impression is a negative replica of the dentition of a person. So a clear impression means that there was significant pressure involved. When there is significant pressure involved, we get a very clear impression. And if a clear impression, then that means a good mold can be poured out on top of it. An obvious bite signifies medium pressure. We don't get a good impression out of it, a good mold out of it. And a noticeable impression is when the biter has used violent pressure to bite. So different types of impressions are got depending upon the intensity of the bite, you can say. Different types of bite marks inflicted can be sexually oriented. They are inflicted slowly and deliberately with suction applied to the tissue by tongue and lips. Human bites have been recorded on most anatomical parts of the body. It has been noted that the bite location varies depending upon the crime and the sex of the bitten person and the age of the victim. Studies shows that females are bitten more often than males, and frequent sites of the breast, arms, legs during these sexual attacks. Males are commonly bitten on the arms, shoulders, and back. Hands and arms are commonly bitten when a victim is attempting defense actions. In child abuse cases, aggressive bite marks are found. Here we always have to see whether the bite marks are fresh or showing evidence of long-term abuse. Then comes the self-inflicted bite marks. Mentally disturbed individuals and children also cause this, mostly on the forearms and where the mouth can reach. And Lesch-Nyhan syndrome, and it's an X-linked recessively transmitted condition with insensitivity to pain. So the bite marks can be aggressive in such persons. And the bite mark is established as a human bite. The next question should be answered are, was it made through clothing or was it a straight bite? If made through clothing, the swabs were taken for saliva and thereby the DNA check. Both of these can show us a way to analyze how these, whether the person is, say, the potential biter, and whether it is offensive or defensive biting according to the position of the bite marks on the victim. And if there are multiple bites, as I said, whether they were inflicted at the same time or does it show long-term abuse. That usually comes in child abuse cases. And such questions and more are the essential core of the analysis of the bite mark, and provides a large amount of information and it adds value to our case. And this, when combined with other non-dental information and evidence, it can aid the prosecution or the defense. Now, the histopathological changes in the bite marks. So far, so good. But difficulties arise because the bite mark analysis is based on the assumption that the bite marks are permanent. No, it's not. Living skin is a very complex organ system with blood flowing through a vast vascular network pumped by the human heart, all of which gives the skin resiliency, flexibility, and strength. It is rich in pain receptors, which causes a living person to react to the pain of biting and to quickly move away from the injury, from the source of that pain, even if it inflicts more injury. So when the blood vessels are broken, say by being bitten, blood flows into the surrounding tissue. And when the skin is damaged, the body tries to protect itself by releasing prostaglandins and histamines, which causes inflammation. And this is the body's attempt to minimize bleeding and minimize the tissue damage formed. Then the body starts to heal. So now in stage 1, from 0 to 18 hours, scab formation. Stage 2 is 30 to 70 hours, epithelial regeneration. Stage 3, 5 to 12 days, that is subepidermal granulation. Stage 4, after 12 days, regression happens. And only a few studies have addressed the factors that causes the skin distortion, because we have, they have found that, researchers have found that the bite on cadavers with dental models inflicting the bites parallel and perpendicular to the skin tension lines. This is called the Langer lines, with the limbs in different positions, causes when loose and elastic tissue is bitten, the mesial to distal width. When we say mesial to distal width, we always infer that the occlusal surface or the incisal edges of the teeth. So the mesial to distal width is increased when the skin is loose and elastic, and there was flattening of the angles of rotation and the elongation of the intercanine width. Between the canine and the canine. That will be 6 teeth in the front, centrals, laterals, from the midline, central, lateral, and canine. So from the canine to canine, the intercanine width is also increased when the tissue was loose and elastic. And as the tissue became stiffer, reverse effect was seen, because we always take the intercanine width and the width of each teeth in the bite mark analysis. So in this condition, when a loose tissue is bitten, we always find that the intercanine width is increased and there was flattening of the angles of rotation. But as it heals, the reverse effect was seen. Another important finding was that when stress in the tissues was varied, a combination of changes were observed relating to this. So whenever you bite with medium pressure, a different length was seen, and when you apply more pressure, it seems that the distance, the intercanine width was decreasing or increasing depending upon the tissue. So the tissue has its effect. The amount of stress applied also will have its effect. And so the complexities in skin behavior during the process and the discrepancies shown in the bite pattern in relation with the dentition should be addressed with caution. But with the technology advancements available now, with the computer scanning and the printing of the different aids available now, it is possible to get the intercanine width with various stress levels also. This makes it more difficult to accurately preserve the bite inflicted on a live person. And some conditions of the skin may mimic the bite marks, for example, pityriasis rosae, and beware of the medical condition that may predispose to bruising, such as the liver disease or primary hematological disorders. This also has to be taken into consideration when we analyze the bite marks. And it is always important to distinguish the pattern marks made by the animal or insect predation after the person is deceased. So that means when you should understand the postmortem changes that can cause the confusion. So there might be human bite marks also. So after the person is deceased, then there might be animal bite marks also, which has to be seen. So in that case, if the victim is deceased, we have to wait until the lividity stage or pooling of the blood clears and details are visible. Livor mortis refer to the purplish discoloration under the skin of the lower body parts due to the gravitation of blood after death. Onset of lividity, location, and color provides valuable information on concluding the time of death. So the skin changes that happens in the deceased or the living makes it a little more difficult. So we take a series of bite marks, especially like during the changes, if in a living, and record it accordingly. All the photographs of the bite marks or the video presentations are taken with and without the ABFO number 2 scale. It's called the right angle scale. American Board of Forensic Odontologists number 2 scale. This is the scale which we use. And the photographs are taken in a manner which will minimize the distortion. This is a bite mark, and this is how we place the scale. So it should be present on the same plane and it should be adjacent to the bite mark. And time series photographs of the bite mark should be obtained. This is how a bite mark is. The scale is, you can see it. So there will be, on the right hand side, you can see the upper incisor teeth. And the left hand side, you can see the lower incisor teeth. From the upper, there are drag marks from the upper left first premolar tooth. It is self-explanatory. And the maxillary ICD, that is inter-canine with distance. Drag marks from the upper right, lower right canine. So the lower is more, it is imprinted in a much more better way than the upper. Pedicle hemorrhage is seen in this. Pattern association, bite mark photograph of the victim is taken with the scale. Models from the suspect, but for this we need the permission of the suspect, and suspect models are placed directly over the bite mark photograph. Indirect method is incisal and occlusal edges of the suspect teeth traced onto a clear acetate film and superimposed on life-size bite mark photographs. How an impression of the bite mark is taken. Initially, when we find the bite marks, a forensic odontologist is obviously called, and then it is swabbed for saliva and DNA. After that, we try taking an impression of the bite mark because the bite marks keep changing. The first step is prepare the area for the impression by taking by removing all the hair in the area should be washed and dried. So the area is prepared. If you had a visit to the dentist, you will, for a crown or a denture, definitely you will know how the impression is taken. It is a negative replica of whatever we want to replicate. A light body impression material, that is a rubber-based siloxane material, and it is expressed to the injury site with a syringe, and it is allowed to completely cover the injury. We need a negative replica of the bite mark, so this light body impression is allowed to set in there. And before setting, that is when the material is half set, we give a cotton backing. This is to be contoured to the anatomical contour of the injury site. This is because when we take out the impression, otherwise there will be distortion. So cotton backing is placed, and this cotton gives a platform for the plaster of Paris to settle. So first we put the clean and washed and dried the area. Second, we put the rubber impression. Then we put the cotton backing. Then dental plaster is placed onto the cotton packing, and this reinforcement will prevent the inaccuracies being developed in the impressions due to physical distortion. Otherwise, it will be difficult to take out the impression. When you take out the impression, you get the negative replica of the thing what you want to replicate. After that, you pour the cast and then you get a positive replica. This entire process of impression taking and dental stone model fabrication should be properly photographed, and ABFO number 2 scale is always used for reference. As I said, the bite mark analysis is now using the 3D scans, which has made our life much more easier. Video imaging is also useful in addition to the conventional photography. Scanning electron microscope has been used to determine the three-dimensional characteristics which were not visible to the human eye, such as the roughened edge of the biter's tooth. So it is very difficult to exactly see the incisal edges imprint which is there on the mark, but using this 3D scans and dental print, it has become much more easier and more accurate. Scanning photomacrography is also used, and the study states that the resulting photographs are comparable to the natural bites. The use of computerized axial tomographic scanning, that is a CAT scanning, to obtain specific registration of the suspect's incisal edges for comparison to the victim's bite mark has also been reported. And impressions of the suspect's dentition gained from the CAT scan were then transmitted into the transparent paper for the comparison purpose. And this is used now rather than the traditional wax bite method of incisal registration, because this is more accurate. And in this, we can even check the stress variation. You can get different readings for the different types of stress bites, the biting stress which is involved, because the amount of force which is given per bite will be different. So it will be like constant, there will be constant variations, but all those stress variations and the amount of force inflicted during each bite can be recorded and mimicked using these digital prints, which are very useful. Now, the overlays are compared with the photographs of the bite marks. So this is how it is taken. You can see the ABFO number 2 ruler in between, and this is how it's done. The dental identification system, genuine image has a smaller matching distance than the imposter image. So it is always the intercanine width and with the incisal edges in place. It is always easy to go about it. Life has become much more easy to the forensic odontology with the advancement of the technology. This is a modified Interpol postmortem odontograph. This is what you need to fill. The site of discovery, everything is in detail. The crimes solved using bite marks. The landmark case was in 1967, in fact, and that was a Gordon Hay case. The body of the 15-year-old Linda Peacock was found in a cemetery in Edinburgh, Scotland, and the investigating officers focused on their attention, and it was a 17-year-old boy, Gordon Hay, and he was the first one to be tried. He was convicted of murder, and his trial in 1968, the jury found the bite mark evidence convincing, and he was the first one to be convicted. in this murder of this little girl. That was way back in 1968. And he was the first person in the UK to be convicted by the forensic dentistry, and this case set an important precedent, paving the way for such evidence to be used in other cases of rape, assault, and murder. The most famous case is the crime which was solved in 1978. In 1978, about 30 numerous young women were killed in various parts of USA between 1974 and 1978, around 30. And if Ted Bundy, his name is Theodore Robert Ted Bundy, and if he was not a biter, it was not possible to be convicted of his crimes. He was sentenced to death in 1989. He was executed, in fact, and he was on death row for years, giving out bits of formation. He was a potential biter, and he had a tendency to bite his victims. So that is how his case was nailed. So his bite became the nail in his coffin. There are many interesting cases, but then we will not go much into it. Now, bite mark analysis is by no means the whole discipline of forensic dentology. It is a very vast area which includes dental identification, age estimation, sex determination. It has a huge role in mass disasters, role in domestic violence, abuse, and neglect. And we have gone through the identification of bite marks and blood group determination. When we come into the blood group determination, that is also possible using the dental remains. Recent advances are DNA typing, computer-assisted dental identification, digital analysis, and digital autopsy. Identification, the DNA source, teeth are always a rich source of DNA, especially the pulp inside the tooth. But in case of fires or any mass disasters involving fires, what happens is the whole body gets burned. The only thing what we get are the bones and the teeth. So the teeth is a rich source of DNA, especially the pulp. The pulp gets destroyed, but the dentine of the teeth contains more DNA than the enamel. So in addition, the dentin is surrounding the pulp. So there will be remnants of pulp attached to the dentine. So the tooth it is cooled at extreme low temperatures using liquid nitrogen, and the mechanically ground to powder, and sufficient amount of DNA is obtained. So that links it to the person. And dental identification is possible only through the X-rays, antemortem and postmortem. X-rays are available, so that is how it is. Sex determination, the teeth that we find in the males and females are totally different, and they have certain specifications for it. So that is how the sex determination is also possible. Age, definitely, as we all say, age definitely carries a lot of importance, because as we age, the wear and tear of the natural dentition happens. So that also is detrimental in determining the age of a person, or a person in the sense, in mass disasters, all this is very useful. Role of forensic dentistry in mass disasters. So when the number exceeds the capacity of the local jurisdiction, I always had problem with this word, responsible for forensic investigation, it is termed as a mass disaster. In such a situation, two teams are inducted. Site team, it involves collection of post-mortem data, and home team involved in collection of ante-mortem data. So there will be an on-site team which is involved in collection of all the post-mortem data available, and the home team will help them because by collecting the antemortem, we have to compare the postmortem and the antemortem data, and then done. And there are 4 types of dental identification, that is positive, possible, insufficient, and exclusion. The antemortem and postmortem data match to establish that it is from the same individual. So that makes it a positive identification. Possible identification is the antemortem and the postmortem data have few consistent features, but because of the quality of records, it is difficult to establish the identity. But possible identification. And insufficient evidence, when there is no data to, especially when you don't have a antemortem data, it is very difficult for a. Now we are talking about forensic odontology as a whole, not for bite mark analysis. Bite mark analysis is a part of forensic odontology. Exclusion is when the antemortem and the postmortem data clearly is inconsistent, then yes, it is excluded. In many cases, dental identification, fingerprint, and DNA are the most commonly used ones, and they often complement each other. That is why earlier I said it is used as an adjunct. It is a validated science. It is a valid science, but in spite of that, certain countries don't accept it. And here, for a positive identification, as I said, we must have the dental records, and even if only a few teeth are available, and we can compare it from the x-rays of the antemortem data and the postmortem data, and it is very easy for that. X-rays, if not available, even by looking at some of the teeth which we get, yes, it is possible, especially from the family, we get more and more data, like, a crown fixed or a bridge, all these things which don't get destroyed by fire or in any mass disasters. Historical evidences, Dr. Oscar Amedo, he is considered as a father of forensic odontology, and dental evidence played a very vital role in the historical case of the identification of our Adolf Hitler. His dental findings were compared with the antemortem dental records and radiographs. He committed suicide along with his wife on April 30th, 1945 in Berlin. And it is believed that the Russian forces found their remains and performed autopsies on the couple. But until late 1968, it was all kept a secret. It was a very well kept mystery. Hitler's skull fragments with maxillary and mandibular arches were retrieved from the Kremlin archives and were matched with evidence submitted by his personal dentist. His personal dentist was Dr. Hugo Blake, and he was his personal dentist from 1934. So he presented the records, and later in 1968, it was confirmed that it was remnants of Adolf Hitler. Dentition was an important lead in the identification of remains of various leaders after death, like Zia-ul Haq, former Pakistani president, and Rajiv Gandhi, former Indian president. And in 2003, the 2 sons of Saddam Hussein were killed by US military in Mosul, Baghdad. Numerous missile attacks had severely disfigured the bodies. Both the bodies of Odeh and Kasaf were identified positively from their dental records. And casualties in the collapse of World Trade Center on September 11th, 2001. Several bodies were identified from their dental records. And recently, the suspects in the Nirbhaya case were identified by the Forensic Odontology Department of SDM Dental College, Dharwad, headed by Dr. Ashita Acharya. First formal instructional program in forensic dentistry was given in the USA at Armed Forces Institute of Pathology. It's a valid science, as I said, and accordingly, the relevant factors such as the quality of the bite mark, the expertise, and the integrity of the analyst fall into place, a forensic odontologist can provide a very reliable analysis. However, if those factors are questionable, bite mark evidence have become more or less dangerous. Coming to the conclusion, in this current scenario, techniques and methodologies must be scientifically robust with regard to reliability, reproducibility, and validity. Therefore, it's important that the forensic dental associations, societies, and individuals around the world involved in this subject attempt to standardize the procedure. As of now, it is still in its nascent stage, I would say. And they should standardize the procedure terminology for the bite mark work and introduce some form of accreditation, mentoring, peer review, and revalidation for those undertaking bite mark analysis. ABFO has put considerable work into the subject, endeavoring to increase the quality and reliability of bite marks and evidence. The British Association for Forensic Odontology is also doing similar steps. Thank you so much.
Thank you, Dr. Smitha. Excellent talk. That was a very interesting topic and a lot of new things to learn. Waiting for questions to come in. In the meantime, I will start off with some questions for you. You talked about impression from the mark. So that was my actually first question, but you made it very clear that they take impressions either from the perpetrator or from the victim, right?
Yes.
Both ways it's possible.
Yes.
Right, okay.
There are self-inflicting bite marks also.
That's another important thing. Bite marks could be self-inflicted, yeah.
And again, in defense also, people bite. So it's like,
So that brings me to the question, why do human beings actually bite? I mean, they eat food with their mouths and they need the teeth for that. But why do they bite actually? Is it something to do with, is it more of oral gratification or is it because of pain and pleasure go together? What is the
I think,
reason?
yes, it is more of, I will not say oral gratification as such. That is also a part of it. But sometimes people bite with happiness also.
Pain and pleasure going together. Yeah. Okay.
Yes.
All right. Dr. Limia was asking, where are the pictures? I think you showed some pictures of bite marks. I think I hope that's what she meant. I don't know whether that was an innocent question or was it a very naughty question. But anyway, I think you showed the pictures. Okay. If if a teeth is missing, do you take into account that as well? I mean, is that something?
Because that will be valid evidence, in fact. Because if a teeth is missing, then in the bite, the teeth will not be visible. So for the potential bite, it is to relate the patient to the bite. Basically, the bite mark analysis finds out the potential biters, and then when it is matching, then it goes further.
Right. Okay. So you also said about the incisor distance, intercanine distance, right?
Yes.
Intercanine distance. Intercanine because why only canines? I mean, is it something that is fixed in most people? I mean, it's unique to that particular person. Is that how?
It is. It is unique. It is unique to that particular person because the canine is in the smile line or in the bite line. The main thing that gives an imprint is the canine because that is the longest and the sharpest tooth in the oral cavity.
So more likely that the canines will leave impression rather than anything else. Yeah.
That's right.
Okay.
See,
there are a lot of. Yeah. Go ahead.
No, because there are a lot of cases. See, in my case, personally, I don't have lateral incisors. So the intercanine width will be always small. But that can definitely make me the suspect and they can because it is individualistic patterns will be different.
Right. Okay. All right. A lot of people are appreciating. Very nice presentation. No question for a change from Dr. Manjeet. Anyway, can you tab on your screen?
Yes.
Okay, because mine is saying loading questions. So if you can take a question, if you can see the question, maybe you can take a question and answer. Just
Okay. I will
speak
just.
out the question so that everybody can hear. Yes, Dr. Lal is asking, very good presentation with a lot of new information. Is there a difference between bite marks with natural teeth and artificial teeth?
Yes. The amount of
Yeah.
force given by the artificial teeth and the normal teeth is different. So even in the bite marks, it will be inflicted like that. There will be definitely a difference.
He's also asking whether the mode of treatment for both the bites are the same. In our place, it is said that bite by a natural teeth is more toxic. Is it true? Which place is it? I don't know which place is this. anyway, anyway, go ahead.
This basically because of the saliva content which goes inside the bite. That is what they say. Depending upon how poisonous your saliva is, I guess might be more toxic and less toxic.
Yeah, Arun also asking a similar question. We were actually
So
planning this talk to go with Arun's talk, but anyway, Arun, good to have you back, Arun. He says, superb talk. Happy to see you. Is it true that human bite is the poisonous bite?
again, it comes to the saliva involved.
I think also to do with the fact that a lot of anaerobic bacteria are there. So when the bite mark goes deep into the skin, it's a tiny hole and creates an anaerobic environment, so bacteria can proliferate. We are often told, for example, in bite marks in the tendons in the hands, the tendon can retract and take back the bacteria in the saliva, and there can be a festering wound infection. So it can be a problem, even though there's a small wound, there may be a big infection inside.
That is right.
Neeta is telling interesting presentation. Thank you, Dr. Smitha. Dr. Bapu is telling very nice presentation. Dr. Ashok has a question. You mentioned
You will come with this.
you mentioned about paranormal bites. Can you elaborate? What is
See,
paranormal
paranormal
bites?
bites are not substantiated with evidence as such. So that is why I didn't go much into it. But they say that it can be self-inflicted bites also. So usually the paranormal bites which are seen are found in the areas which a person can bite themselves. So whether it is a self-inflicted bite or whether it is a paranormal bite, again, it is.
Yeah, I
That's the
think that's a
reason
very
why.
important observation. Paranormal bites are always at accessible places. Okay.
Yeah, that's right.
Right. So meaning it's not really paranormal, mostly. Yeah.
They don't
Great.
usually bite. That is what the other theory goes about. The paranormal forces don't inflict injuries on another person like bite, I guess.
Okay. Interesting.
And
Okay. Any more questions you can see, Dr. Smitha?
yeah,
Mine is still
Arun
loading.
is repaired to penile bite. They were raped in prison. It is difficult to repair. It took 3 months to repair. One reason is that semen exposure makes it more worse. Bite anywhere should be repaired well, should be cleaned well, and it takes time. Yeah, this could be true. Semen exposure makes it more worse, maybe, yes. So it
I
takes
don't know
time
how
to heal.
that is a
You know it
correction of
better
bite.
than me.
Right. Okay. Excellent. Okay. Good. Actually, we needed Darun to have a presentation that made it perfect.
And Dr. Shashiraj,
Okay.
what a question. Why do people bite?
Yeah. He's making a remark. Why? What a question. It's a valid
Yeah, but
question. Why do people
we have a
bite?
lot of potential biters in the community. If you know, 10%, 10 to 20% people do bite. with happiness or other reasons, yes, have a tendency to bite.
Interesting. Okay, Dima has a question. Nice talk, Dr. Smitha. Hope you're doing good, Dr. Arun. Just to highlight treatment of antibiotic, it is poisonous. Better to give tetanus prophylaxis, treat with augmentin, and give anti-rabies prophylaxis.
If the bite is caused by dogs.
Yeah, so that's why this talk is important.
It is.
I mean, the difference between to differentiate whether a bite is by an animal or by a human being.
I went
That
into
is
this
important.
topic because normal dental talks might not be of interest to a mixed crowd like us. So that is why I went into a topic which might be of little interest to everyone.
Yeah. So they're adding that corollary if the bite is caused by dogs was very important there.
Give
Yeah.
anti-rabies prophylaxis. But TT is
Unless
usually given
the
when you have a bite injury on a living person. Definitely, tetanus prophylaxis is
it is,
given.
yeah, it is. It is. It is. But I think rabies is getting more and more infrequent. But I don't know. It's incidence on dogs. Maybe that's what she's trying to say. We in Mangalore, in the Wenlock Hospital, we used to have one separate rabies ward, and that used to be like a prison. Nurses used to tell patients used to be locked there, and nobody will touch them, just like corona.
It is highly
Anyway, okay.
contagious. That's why.
Yeah.
Any specific measurement to deal with bites in the ER in case of rape and child abuse, as it will be an evidence?
That's an important question.
If you suspect rape and child abuse, definitely it becomes a police case. No?
So you have to take, meaning what he probably is asking is, should I initiate treatment or should I wait?
We have to inform the police first.
If you
If it is
suspect anything like that.
exactly. So if you're sure that, if you feel the evidence of, if it's a case of rape or child abuse, definitely the police has to be, or photograph the evidence at least. But again, there is a problem because you have to make sure that you get the consent from the patient or the people concerned.
Yes. I think practically speaking, you have to speak to the police and then based on how far they are. And
yes, and first collection is collection of DNA from the site, because as we know, DNA deteriorates with time and the temperature, and if washed, all these things, you cannot collect the saliva or the DNA from the bite mark. So that has to be taken into consideration.
Right. Okay. Yeah. Unless it's overtly bleeding wound that needs immediate intervention.
Yeah.
I guess a little bit of waiting will not harm.
Actually, 2
Best is
years
to.
back, I think we had a case of a bite from a dog on the lip of a patient. I think Dr. Abu Bakr was the one who called. But it was a through and through wound, puncture, total. Could not be even suture.
Right. Okay. So that's what he was saying. Shall we treat or wait? I think it's practical to speak to the police.
That is right.
And based on what their advice is, we can proceed.
Exactly.
Unless it's urgently needs attention, like a bleeding wound, obviously, then you need to tackle the wound and then. Yeah. Dr. Lal is asking, is there any forensic odontology in Oman? This corona and rabies interaction is going. Corona is not rabies, rabies is not corona. Yes.
Arun is asking a very interesting question.
Yes, so you can read it out and then answer it.
See, this is why I said 20% of the people are potential biters. We have in the sports arena also, isn't it? Suarez, footballer, has bitten.
Dr. Lal is saying it is called hickey.
Yeah, that is a love bite, yeah? Some doctors in KIMS, I see bite mark on the sides of the neck. What is it? Only on side of the neck. Must be a love bite.
not vampires.
But one more thing is, it can cause on the side of the neck. Must be very little careful. Why? Because jugular vein. So maybe can cause death.
Arun is saying, read my question. Yeah, we read it. She read the question.
Yeah, only on the side of the neck.
Yeah.
That's what I said. It is dangerous.
It's
Better
very
be careful.
dangerous. Okay, all right. Any more questions there? I think that's it. Let's see in the chat section. Some people sometimes put questions that are very informative. Thank you. Dr. Hamid, Dr. Chaudhary. Paranormal bites are seen usually by psychiatric patients, as told by Dr. Smitha. Usually, these turn out to be paranoid schizophrenics, occasionally conversion disorders.
Okay.
Yeah.
All right. He knows more about it.
Yeah. All right.
But I'm interested to see whether we can go deeper into the subject.
Excellent. That's a little out of the normal topic. Nice, Dr. Smitha. Thank you lots for joining us today and making it a wonderful.
Thank you.
Like I told you, so it was fun. That's what we want talks to be like. That keeps people interested and tuned in. Anything else you want to say as closing comments?
It was nice.
Okay, all right.
An honor to talk with
Thank you. Thank you, Dr. Smitha, for taking all the trouble to join us today. Thank you, everyone. We'll wind up on this one. And we have our last talk coming on this Thursday. This was supposed to be the last talk, but one talk was postponed earlier week. So we'll have that talk, Artificial Intelligence in Radiology, on Thursday. And thank you, everybody. Thank you, Dr. Smitha. Goodbye.